Do you often feel like your stomach is acting up after taking antibiotics for a cold or infection? Maybe lots of painful cramps and watery poop that just won't stop. If yes, you might be experiencing something called C. diff infection. It's not common knowledge, but it's more frequent than you think, especially if you've been in the hospital or on strong antibiotics. C. diff is short for Clostridioides difficile, a harmful germ that can take over your gut when good bacteria are wiped out. Think of your gut like a garden. Normally, good plants bacteria keep weeds' bad germs under control. But when you use weed killer antibiotics, sometimes the weeds come back stronger. That's what happens with C. diff. It overgrows and starts causing trouble. What exactly causes C. diff infection? It's mainly from a type of bacteria called Clostridioides difficile. These bacteria aren't dangerous until they multiply out of control. How does that happen? Picture this: you take antibiotics for a sinus infection. Those antibiotics don't just kill the bad bacteria, they also wipe out the good ones in your gut. Without those good bacteria holding them back, C. diff bacteria wake up, grow fast, and release toxins that hurt your intestines. These germs are tough. They can survive on surfaces like doorknobs, toilets, or hospital beds for weeks. If you touch a dirty surface and then eat without washing hands, boom, you could swallow the spores. That's why C. diff spreads easily in hospitals or nursing homes. So how do you know if it's just a bad stomach bug or actual C. diff? Let's play a quick game. Rate how many of these sound familiar. Constant watery diarrhea, like 3 or more loose poops a day. Bad stomach cramps, fever, feeling weak, or even nausea. If you've had these for a few days after antibiotics, C. diff might be the culprit. One key sign is the timing. Symptoms usually start during or up to 2 months after antibiotic use. Imagine this: your grandparent was on antibiotics for a bladder infection. Now they're stuck in the bathroom and feeling awful. It's not just aging, it could be C. diff. In serious cases, people can get dehydrated or develop a swollen colon. Don't ignore it, your gut is shouting for help. How do doctors know it's C. diff? They don't guess, they test. Most often, they ask for a poop sample. Sounds weird, but it's the best way to catch the infection. The lab checks for the toxins made by C. diff bacteria. Sometimes, if things are severe, they might use a camera, like a colonoscopy, to look inside your gut. Now, treatment. If you're on an antibiotic that caused it, the doctor might stop it or switch it. Then, they'll give you special antibiotics like vancomycin or fidaxomicin that target C. diff directly, like sending in a precision strike to remove the weeds without harming the garden. In rare, tough cases, doctors might try a fecal transplant. Yes, really. That's where healthy stool from a screened donor is placed in your gut to bring back good bacteria. Sounds icky, but it works like magic for recurring infections. Can you stop C. diff before it starts? Absolutely. Let's pretend you're a germ detective. Your tools: hand washing, yes, soap, and water, not just sanitizer, because C. diff spores are strong. Always wash after the bathroom and before eating. In hospitals, staff wear gowns and gloves when treating infected patients. Now here's a big one: only take antibiotics when truly needed. Don't pressure your doctor for them. If you have a cold, which is usually viral, antibiotics don't work on viruses. Also, if you're healthy, avoid unnecessary hospital visits. Clean surfaces regularly if someone at home is sick. Prevention isn't hard, just smart habits. Think of it like wearing a seatbelt. It's small, but it saves lives. Scientists are working hard. Imagine a vaccine that stops C. diff before it starts. Some are in testing now. Others are creating smart probiotics, good bacteria designed to fight C. diff directly. Fecal transplants, also called stool therapy, are becoming more standard for stubborn cases and are even being made into pill form. No need for tubes. Researchers are also studying how diet affects recovery. Could eating more fiber help good bacteria bounce back faster? Early clues say yes. Another cool advance: Rapid tests that detect C. diff in minutes, not days. This helps doctors treat faster and stop spread. Bottom line, science is winning, but your actions still matter most.